Let me tell you something that nobody warned you about when you turned 60. Your sexuality didn't retire just because your ovaries did. And yet, here we are in 2026, still whispering about self-pleasure as if it were something shameful, dangerous, or reserved exclusively for the young. Today I'm going to dismantle a myth so deeply rooted in our collective psyche that even mentioning it out loud makes some women uncomfortable. I'm going to tell you, with all the clinical evidence and professional honesty I possess, why masturbation after 60 isn't just safe. It's one of the most powerful tools for physical health, emotional balance, and personal dignity you have at your disposal. But only if you stay with me until the end, because what I'm about to reveal will challenge everything you were taught about aging, femininity, and pleasure. Before we go any further, I need you to do something for me. Hit that subscribe button right now, and down in the comments, I want you to write, "Tell me if anyone ever made you feel like your body had an expiration date." Because that's exactly what we're going to dismantle today, piece by piece, with science, compassion, and the kind of truth that only comes from years of listening to women who've been told their desires don't matter anymore. Let me start with a story. Her name was Patricia, though that's not her real name, of course. She came into my office 3 years ago, at 62, complaining of chronic insomnia, unexplained irritability, and what she described as a general sense that life has lost its color. Patricia had been widowed for 4 years. Her children lived in different states. She maintained an active social life, volunteered at her church, took care of her health. On paper, she was doing everything right. But something fundamental was missing, and she couldn't name it. During our 3rd session, after we'd built enough trust, Patricia confessed something that had been weighing on her conscience. She told me, almost in a whisper, that she'd started touching herself at night. Something she hadn't done in decades, maybe ever with full awareness and permission. And she was terrified that it was wrong, that it meant something was broken inside her, that God would judge her, that her late husband would somehow know and disapprove. Most of all, she was terrified that at her age, it might be physically dangerous. "Dr. Montes," she asked me, her voice trembling, "is there something wrong with me? Am I safe?" I looked at her. This intelligent, accomplished woman who'd raised 3 children, built a career, navigated loss with grace, and I felt that familiar mix of compassion and frustration that comes from witnessing how thoroughly we've failed women when it comes to sexual education across the lifespan. "Patricia," I told her, "not only is there nothing wrong with you, but what you're doing is one of the healthiest things you could possibly do for your body and mind at this stage of life. And yes, you are absolutely safe." The relief that washed over her face in that moment is something I'll never forget. It was as if I'd given her permission to be human again, to inhabit her body fully, instead of just maintaining it like a museum piece from a closed exhibit. That conversation is why we're here today. Because Patricia isn't unique. In my practice, I've encountered dozens of women like her. Vibrant, capable, intelligent women who've been conditioned to believe that their sexual self should politely disappear sometime around menopause, or that acknowledging their own pleasure is somehow selfish, inappropriate, or medically risky. And I'm here to tell you, that's nonsense. Dangerous nonsense, actually, because it keeps women disconnected from a fundamental source of well-being, autonomy, and vitality. So let's talk about what actually happens in your body during and after masturbation, shall we? Because understanding the physiology removes the shame and replaces it with something much more useful: informed choice. When you experience sexual arousal and orgasm, whether alone or with a partner, your body initiates a cascade of neurochemical and physiological responses that have measurable health benefits. Your heart rate increases, improving cardiovascular function. Blood flow throughout your body intensifies, which is particularly important for maintaining healthy tissue, including vaginal and vulvar tissue that can become thinner and drier after menopause. Your brain releases a cocktail of neurotransmitters: dopamine, which activates your reward and pleasure centers; oxytocin, which promotes bonding, reduces stress, and has natural pain-relieving properties; and endorphins, your body's natural opioids, which create feelings of well-being and can help with everything from chronic pain to mood regulation. Here's what I want you to understand. These aren't luxuries. These are fundamental biological processes that support your health. Orgasm triggers the release of prolactin, which promotes sleep quality, something many women struggle with after menopause. It reduces cortisol, your primary stress hormone, which when chronically elevated contributes to inflammation, weight gain, cognitive decline, and cardiovascular disease. Sexual activity, including self-pleasure, has been linked to improved immune function, better bladder control through the natural strengthening of pelvic floor muscles, and even enhanced cognitive performance in older adults. There's a study I often cite that looked at sexual activity and cognitive function in adults over 50. The researchers found that those who maintained regular sexual activity, including masturbation, showed better performance on tests of memory, executive function, and verbal fluency compared to their sexually inactive peers. Now, correlation isn't causation, and we always have to be careful about drawing overly simplistic conclusions. But the biological mechanisms make sense: increased blood flow to the brain, reduction of chronic stress, maintenance of neural pathways associated with pleasure and reward, and the simple fact of engaging in an activity that requires presence, sensation, and attention. Let me pause here because I know what some of you are thinking. You're thinking, "But Dr. Montes, I was raised to believe that masturbation is shameful, sinful, or at minimum something you're supposed to outgrow once you have a partner or reach a certain age." I understand. Many women in your generation received messages about sexuality that were restrictive, fear-based, and fundamentally disconnected from the reality of how bodies actually work. You were taught that sex was for procreation or for pleasing a partner, not for your own exploration or pleasure. You might have been explicitly told that touching yourself was dirty, dangerous, or evidence of moral failing. I'm not here to argue with your religious or cultural values, but I am here to separate belief from medical fact. And the medical fact is this: masturbation is a normal, common, healthy sexual behavior across the lifespan. It doesn't cause illness, weakness, mental instability, or divine punishment. What it does cause, when approached with awareness and self-compassion, is an opportunity for embodied autonomy, a chance to know your own body, understand what brings you pleasure and comfort, and maintain a sense of vitality that's entirely within your control. Think about it this way. If I told you that there was a free, accessible activity you could do in complete privacy that would improve your sleep, reduce your stress, enhance your mood, support your cardiovascular health, maintain the health of your vaginal tissue, and give you a sense of agency over your own body, you'd probably be interested, right? You might even wonder why nobody told you about it sooner. Well, that activity exists. You've always had access to it. We just haven't given you permission to claim it without shame. Now, let's address the safety question directly, because that's often where fear lives. Is masturbation safe after 60? For the vast majority of women, yes, absolutely. But as with any discussion of health, nuance matters, and I'm going to give you the full picture. First, let's talk about cardiovascular considerations. Some women worry that the increased heart rate and blood pressure during sexual activity might trigger a cardiac event. The truth is, for most people, the cardiovascular demands of sexual activity, including masturbation, are quite modest, equivalent to climbing a couple flights of stairs or taking a brisk walk. If you can do those activities without chest pain, severe shortness of breath, or other concerning symptoms, you can almost certainly masturbate safely. However, if you have significant heart disease, poorly controlled high blood pressure, recent heart surgery, or if you've been advised by your cardiologist to restrict physical activity, then you should have a conversation with your doctor. Not because masturbation is uniquely dangerous, but because any physical exertion needs to be calibrated to your current cardiovascular status. And here's what I tell my patients. Most cardiologists, if you ask them directly, will tell you that the psychological and physical benefits of maintaining sexual activity likely outweigh the minimal cardiovascular risk for the majority of their patients. But you need individualized guidance. Second, let's talk about pelvic health. After menopause, declining estrogen levels affect the tissues of the vulva and vagina. They may become thinner, drier, less elastic. This is called vulvovaginal atrophy, or more recently, genitourinary syndrome of menopause. For some women, this makes any kind of sexual activity, including masturbation, uncomfortable or even painful. Here's where understanding your body and being willing to adapt becomes crucial. If you're experiencing vaginal dryness, using a high-quality, water-based or silicone-based lubricant isn't optional, it's essential. Lubrication reduces friction, prevents micro-tears in delicate tissue, and makes the experience pleasurable rather than painful. And here's something important. Regular sexual activity, including masturbation, actually helps maintain vaginal health by promoting blood flow to the area, which supports tissue integrity. It's a use it or lose it situation, quite literally. Women who maintain regular sexual activity, with or without a partner, tend to have better vaginal health than those who don't. If you're dealing with significant atrophy, there are medical treatments available. Topical estrogen, applied directly to the vaginal tissue, is highly effective and has minimal systemic absorption, meaning it treats the local problem without significantly affecting your overall hormone levels. There are also non-hormonal options like vaginal DHEA. Don't suffer in silence because you think this is just part of aging you have to accept. It's a treatable medical condition, and addressing it can dramatically improve your quality of life, sexual and otherwise. Third, let's discuss the emotional and psychological aspects, because safety isn't just about physical risk. Some women experience guilt, shame, or anxiety around masturbation that can actually interfere with their ability to relax and experience pleasure. If every time you touch yourself you're flooded with negative thoughts, critical voices, or fear of judgment, that's a form of psychological distress that matters. Your emotional well-being is part of your health. Here's what I want you to know. You are allowed to experience pleasure. You're allowed to explore your own body. You're allowed to have desires, fantasies, and curiosities at any age. Pleasure isn't frivolous. It's a fundamental part of being alive. And self-pleasure, specifically, is an act of autonomy and self-knowledge that nobody can take away from you. It requires no partner, no negotiation, no performance. It's entirely yours. I've worked with women who've told me that learning to masturbate, or relearning it with permission and awareness, was one of the most liberating experiences of their postmenopausal years. After decades of sex that was primarily focused on their partner's pleasure, or on procreation, or on simply fulfilling an expectation, they finally discovered what actually felt good to them. They learned that their bodies were still capable of sensation, pleasure, and response. They reclaimed something that had been taken from them, often so gradually they didn't even notice it was gone. Let me tell you about another patient. I'll call her Margaret. She was 67 when we met, recently divorced after a 40-year marriage. Margaret described herself as sexually shut down. She hadn't experienced desire or pleasure in years, maybe decades. Her ex-husband had been critical of her body, dismissive of her needs, and sex had become something she endured rather than enjoyed. After the divorce, she assumed that chapter of her life was simply over. But something unexpected happened. About a year after her divorce, Margaret started having dreams, vivid sexual dreams that surprised and confused her. She hadn't thought of herself as a sexual being in so long that she didn't know what to do with these feelings. She was embarrassed to discuss it, even with me, but she also felt this pull, this curiosity. "It's like my body is trying to tell me something," she said, "but I don't know if I should listen." We talked about what those dreams might represent, not just sexual desire, though that was part of it, but a deeper stirring of aliveness, of wanting to feel something again after years of emotional numbness. I encouraged her to explore gently, without pressure or expectation. To get curious about her body, to touch herself not with the goal of orgasm necessarily, but simply to reconnect with sensation, with presence, with the reality that she was still here, still alive, still capable of feeling. It took Margaret several months. She bought her first vibrator at 67, ordered it online because she was too embarrassed to go into a store. She told me later that the first time she used it, she cried, not from pain or regret, but from relief. Relief that her body still worked, that pleasure was still accessible, that she wasn't as broken as she'd believed. Margaret's story isn't unique. I've heard versions of it from dozens of women. What strikes me every time is how much unnecessary suffering comes from the belief that sexuality has an expiration date, or that wanting pleasure is somehow incompatible with dignity, maturity, or respectability. These beliefs don't serve you. They limit you. They keep you small and disconnected from your own life force. So let's talk about practical considerations, because knowledge without application is just theory. If you're interested in exploring masturbation or returning to it after a long absence, here's what I recommend based on both clinical evidence and the real experiences of women I've worked with. Start with curiosity, not performance. You're not trying to achieve anything or prove anything. You're simply exploring what your body responds to, what feels good, what creates sensation or pleasure, or simply comfort. Give yourself permission to take your time. This isn't a race or a task to complete. It's an exploration. Create an environment that feels safe and comfortable. Privacy matters. Lock the door if you need to. Choose a time when you won't be interrupted or rushed. Some women find it helpful to take a warm bath first, to help them relax and get out of their heads and into their bodies. Others prefer their bed or a comfortable chair. There's no right way to do this. If you're dealing with vaginal dryness, which is extremely common after menopause, use lubricant. I cannot stress this enough. Adequate lubrication transforms the experience from potentially painful to pleasurable. Look for products that are glycerin-free and paraben-free, as these ingredients can cause irritation for some women. Silicone-based lubricants last longer and don't dry out, which can be helpful. Water-based lubricants are easier to clean up but may need to be reapplied. Consider using tools. Vibrators aren't just for the young, and they're not shameful or evidence that you're abnormal. They're tools that can make stimulation easier and more effective, particularly if you have arthritis in your hands, reduced sensitivity due to age-related changes, or simply want a more efficient path to pleasure. There are countless options available now, many designed specifically with older women in mind, quieter, easier to hold, with adjustable intensity. Pay attention to your pelvic floor. If you've had children, if you've dealt with pelvic organ prolapse, or if you have issues with urinary incontinence, you might worry about whether sexual activity will worsen these conditions. Generally speaking, masturbation is not going to harm your pelvic floor. In fact, the contractions that occur during orgasm can actually strengthen these muscles. However, if you're experiencing significant pelvic floor dysfunction, working with a pelvic floor physical therapist can be incredibly helpful. These specialists can teach you exercises and techniques to improve both your symptoms and your sexual function. Explore beyond genital touch. Sexuality and pleasure aren't confined to one part of your body. Many women discover that breast stimulation, inner thigh caresses, or even just mindful, sensual touch on any part of their body can be arousing and satisfying. Embodiment, the practice of being fully present in your physical form, is something we often lose as we age, as we become more focused on what our bodies can't do anymore, rather than what they can. Masturbation can be a practice of coming home to yourself. Here's something I need to address directly: the role of fantasy and mental stimulation. Many women struggle with allowing themselves to fantasize, particularly if their fantasies don't align with who they think they're supposed to be, or what they think is appropriate for their age or values. Let me be clear. Your fantasy life is private, personal, and not subject to moral judgment. What you think about during masturbation has no bearing on your character, your values, or your actions in the world. Fantasy is imagination. It's a mental space where you can explore, experiment, and experience scenarios that you might never choose in reality, and that's perfectly healthy. Some women find that erotica, whether written or visual, helps them access arousal, particularly if they've spent years disconnected from their sexuality. There's no shame in using these tools if they work for you. Others prefer their own imagination, memories, or simply focusing on sensation without narrative. All approaches are valid. Now, I know some of you are sitting there thinking, "This all sounds fine in theory, Dr. Montes, but I don't even know if I want this anymore. My libido is gone. I'm not interested. Does that mean something's wrong with me?" Let's talk about desire, because this is where things get interesting and complex. Sexual desire in women is not a simple on-off switch. It's influenced by hormones, yes, but also by stress levels, relationship dynamics, body image, past experiences, medication side effects, sleep quality, chronic pain, depression, anxiety, and about a dozen other variables. After menopause, when estrogen and testosterone levels drop, many women do experience a reduction in spontaneous desire, that feeling of wanting sex out of nowhere, without any particular trigger. But here's what the research shows. For many women, particularly as they age, desire becomes more responsive than spontaneous. This means you might not feel desire until you're already engaged in sexual activity. You don't feel turned on until you start touching yourself or being touched. And that's completely normal. It's a different pattern of desire, not an absence of desire. If you're waiting to feel desire before you engage in sexual activity, you might wait forever. Instead, you might need to consciously create the conditions for desire to emerge: privacy, time, relaxation, sensory stimulation. You might need to start the physical activity even when you don't feel particularly interested, and see if desire shows up once you're engaged. For many women, it does. However, I also want to validate something else. You are not required to be sexual. If you genuinely have no interest, no desire, and no sense that you're missing anything, then don't force it. Asexuality is a legitimate orientation. Low desire that doesn't cause you distress is not a medical problem. The question is, are you content with where you are, or do you feel like you've lost something important and want it back? If you're in the latter category, if you miss your sexuality, if you feel disconnected from a part of yourself that once mattered, then it's worth exploring what's getting in the way. Is it physical, hormonal, emotional, relational? Often it's a combination, and often addressing the barriers opens up possibilities you thought were closed forever. Let me share something I've observed over years of practice. Many women experience a resurgence of sexual interest and confidence in their 60s and beyond, particularly if they're willing to let go of old scripts about how sex is supposed to look. Without the demands of young children, without concerns about pregnancy, sometimes without the pressure of a partnership, they have space to discover what they actually want rather than what they think they should want. I've had patients tell me that sex in their 60s and 70s is better than it ever was in their 20s or 30s, not because their bodies work the same way, they don't, but because they finally know what they like, they're not performing for anyone, and they've developed the confidence to prioritize their own pleasure. That's powerful. That's worth pursuing if it matters to you. Now let's address another concern that comes up frequently. What if I'm in a relationship? What does masturbation mean in that context? Does it signal that something's wrong between me and my partner? Short answer, no. Masturbation and partnered sex serve different needs and they're not in competition. Even in the healthiest, most sexually satisfying relationships, individuals often masturbate. It's different. It's about your relationship with yourself, not about the quality of your partnership. Some people masturbate more when they're happily partnered because regular sexual activity keeps their libido active. Others masturbate to meet needs that are different from what partnered sex provides, maybe quicker, more focused, less energy-intensive. If you're in a relationship where your partner is critical of your masturbation or tries to control it, that's a red flag about power dynamics, not about masturbation itself. Your body is yours. Your pleasure is yours. Nobody else gets to dictate how you relate to your own physical experience. On the other hand, if you're masturbating as a way to avoid intimacy with your partner, or if it's become a substitute for addressing problems in your relationship, then that's worth examining, not because masturbation is the problem, but because avoidance is. Use it as information about what might need attention. Many couples find that talking about masturbation, sharing what they've learned about their own bodies, actually enhances their sexual connection. It removes the pressure of mind reading and provides concrete information about what creates pleasure. But that requires vulnerability and trust, and not all relationships have created space for that kind of honesty. Let's talk about the neuroscience of pleasure for a moment, because I think it helps to understand what's actually happening in your brain when you experience arousal and orgasm. Your brain has a reward system, primarily mediated by dopamine, that evolved to reinforce behaviors essential for survival: eating, bonding, procreating. Sexual pleasure activates this system intensely. When you experience arousal and orgasm, multiple brain regions light up: the nucleus accumbens, reward and motivation; the amygdala, emotion; the hippocampus, memory; the anterior cingulate cortex, attention and emotion regulation; and the prefrontal cortex, decision-making and self-awareness, which actually decreases during orgasm, allowing you to let go of self-consciousness. Here's what's fascinating. These neural pathways remain active and responsive throughout your life. Yes, hormone changes after menopause affect things. Yes, age-related changes in nerve sensitivity matter. But your brain's capacity for pleasure doesn't disappear. Neural plasticity, your brain's ability to form new connections and strengthen existing ones, continues even in older age. Every time you engage in pleasurable activities, including masturbation, you're literally maintaining and strengthening these neural pathways. Use it or lose it applies to your brain just as much as it applies to your muscles. There's also compelling evidence that regular orgasm has neuroprotective effects. The surge of oxygen and nutrients to the brain during sexual activity, combined with the cascade of beneficial neurochemicals, may help protect against cognitive decline. We're still learning the specifics, but the relationship between sexual activity and brain health is one of the most exciting areas of research in aging and neuroscience. Think about that for a moment. Something that feels good, that costs nothing, that requires no prescription or medical intervention, may also be protecting your cognitive function. How often does that happen? We should be celebrating this, not hiding it behind shame and silence. I want to address something that might feel uncomfortable but is crucial: the intersection of masturbation and grief. Many women lose partners in their 60s, 70s, and beyond. Widowhood brings profound loss. And part of that loss is often the loss of physical intimacy and touch. In our culture, we don't talk much about the sexual grief that accompanies losing a spouse. We focus on emotional loss, companionship, shared history, all of which are real and significant. But the loss of touch, of being desired, of sexual connection, is also real. Some widows feel disloyal when they experience sexual desire after losing a partner. They worry that wanting pleasure means they didn't love deeply enough, or that they're somehow betraying their spouse's memory. Let me say this as clearly as I can. Your continued aliveness, including your sexuality, is not a betrayal. It's a testament to your vitality. Grief and pleasure can coexist. Your capacity for joy and sensation doesn't diminish the love you had or the loss you've experienced. Masturbation can be a way of maintaining connection with your own body during a time when you're no longer receiving touch from a partner. It can be a form of self-care, a way of saying, "I'm still here, I still matter," when everything else feels uncertain or empty. It can also simply be a tool for stress relief and sleep during a difficult time. None of these motivations are selfish or inappropriate. They're human. I've worked with widows who told me that their first orgasm after losing their husband made them feel alive again for the first time in months. They felt guilty about that aliveness, as if experiencing pleasure was incompatible with honoring their grief. We worked on reframing. Pleasure isn't the opposite of grief. Sometimes pleasure is what allows you to continue carrying grief without being entirely consumed by it. It's a moment of respite, of remembering that life continues, that your body still has the capacity for something other than pain. Let's shift to something practical: troubleshooting common challenges. Because it's one thing to say masturbation is healthy, and another thing to navigate the real obstacles women encounter. Challenge 1. I can't seem to achieve orgasm anymore, or it takes forever. This is common after menopause. Decreased genital sensitivity, hormonal changes, medications, particularly SSRIs for depression or anxiety, and age-related changes in blood flow all contribute. First, adjust your expectations. What used to take 5 minutes might now take 20. That's okay. If you have the time and patience, that extra time can actually become an opportunity for deeper relaxation and embodiment rather than a race to the finish line. Second, consider a vibrator if you're not already using one. The more intense stimulation can compensate for reduced sensitivity. Third, talk to your doctor about whether any medications you're taking might be interfering. Sometimes adjustments are possible. Fourth, if you haven't tried topical estrogen or testosterone for vulvovaginal health, discuss it with your provider. These hormones used locally can improve tissue health and sensitivity without significant systemic effects. Challenge 2. I feel uncomfortable or awkward, like I don't know what I'm doing. Remember, you're not performing for anyone. There's no right way to do this. Give yourself permission to experiment without judgment. Some women find it helpful to start with self-massage that's not explicitly sexual, touching their body in ways that feel comforting and pleasurable without immediately focusing on genitals. This can help you relax and feel more at home in your body. Others find that reading erotica or looking at sensual images, if that aligns with your values, can help bypass the awkwardness by giving your mind something to focus on other than self-consciousness. Challenge 3. I experience pain or discomfort. Don't push through pain. Pain is information. If penetration is uncomfortable, don't do it. Focus on external stimulation instead. If even external touch is painful, you may have vulvar or vestibular pain conditions that need medical attention. Lichen sclerosis, for example, is a skin condition that becomes more common after menopause and causes pain, itching, and discomfort. It's treatable. Painful sex or masturbation is never something you just have to live with. See a healthcare provider who specializes in sexual medicine or vulvovaginal health. Challenge 4. I'm dealing with urinary incontinence and worry about leakage during arousal or orgasm. This is called coital incontinence, and it affects many women, particularly those who've had multiple vaginal deliveries or pelvic surgery. Empty your bladder before masturbation. Use waterproof padding if you're concerned about protecting your bedding. Work with a pelvic floor physical therapist to strengthen your pelvic floor muscles and improve bladder control. Don't let fear of incontinence keep you from sexual activity. There are practical workarounds. And again, the muscular contractions during orgasm can actually help strengthen your pelvic floor over time. Challenge 5. I feel guilty, like I'm doing something wrong or shameful. This is the hardest obstacle because it's psychological and often deeply rooted. Shame thrives in silence and secrecy. If you can, talk about it with a trusted friend, a therapist, or even in a journal. Question where these messages came from and whether they actually serve you now. Many women find it helpful to actively counter shameful thoughts with affirmations or new narratives. My body is mine. Pleasure is not wrong. I deserve to feel good. This is healthy and normal. Over time, these new messages can begin to replace the old ones. Cognitive behavioral strategies can be remarkably effective at reducing shame and anxiety around sexuality. Let me tell you about Rosa. She was 61, raised in a strict religious household where any discussion of sex was taboo and masturbation was explicitly condemned as sinful. Rosa had internalized these messages so deeply that even in middle age, even after decades of marriage and 3 children, she'd never touched herself sexually. Never. Not once. She didn't even know really how or what she might be looking for. Rosa came to me because she was experiencing severe anxiety and depression following her husband's death from cancer. In our work together, it became clear that part of her distress was a profound disconnection from her body and a complete absence of any sense of agency over her own physical experience. Everything in Rosa's life had been about taking care of others, following rules, meeting expectations. She'd never developed a personal relationship with her own body. I suggested, very gently, that she might benefit from learning to experience pleasure on her own terms. Rosa was horrified at first. The old messages were so strong. But she was also exhausted from a lifetime of rigidity and self-denial. She was willing to try, even though it terrified her. We started small. I asked her to spend 5 minutes a day simply noticing sensations in her body. Not sexual sensations necessarily, just any sensations. The feeling of warm water on her skin in the shower, the texture of soft fabric against her arms, the sensation of her feet on the floor. This practice of embodied awareness was revolutionary for Rosa. She'd spent so many years dissociated from her physical self that just paying attention was a radical act. Gradually, over months, Rosa expanded her exploration. She touched herself in ways that felt good, her face, her arms, her breasts, eventually her genitals. She gave herself permission to be curious. She bought a book about female sexuality. She ordered a small vibrator. And slowly, carefully, she discovered that her body was capable of pleasure, that pleasure wasn't dangerous or sinful, and that experiencing it actually made her feel more alive, more present, more herself than she'd felt in decades. Rosa's transformation wasn't just about masturbation, it was about reclaiming ownership of her own life and body after 60 years of believing they belonged to everyone else. But masturbation was part of that reclamation. It was a tangible, physical way of saying, "This is mine. I matter. My experience matters." I'm telling you these stories because I want you to understand that wherever you are right now, whether you're comfortable with masturbation, curious but uncertain, or convinced it's not for you, there's no judgment here. What I care about is that you're making informed choices based on accurate information and self-awareness, not on shame, fear, or outdated beliefs that don't serve your well-being. Now, let's address a question that comes up occasionally. Can you masturbate too much? Is there such a thing as excessive masturbation? The short answer is, it depends. If masturbation is interfering with your daily functioning, relationships, or responsibilities, that's a problem. But not because of the masturbation itself. It's because any behavior, even a healthy one, becomes problematic when it's used compulsively to avoid life or manage uncomfortable emotions in ways that create more problems than they solve. For the vast majority of women, this isn't an issue. Most women over 60 who masturbate do so infrequently or occasionally, not compulsively. The concern about too much is usually more reflective of lingering shame than actual dysfunction. If masturbation brings you pleasure, helps you sleep, reduces your stress, and doesn't interfere with the rest of your life, then you're fine. There's no magic number. Some women masturbate daily, some weekly, some monthly, some never. All of these are normal variations. However, if you find yourself using masturbation as the only way you can cope with stress, or if you're masturbating in ways that cause physical harm through excessive force or frequency that leads to tissue damage, then it's worth examining what's driving that behavior and whether there are healthier coping strategies you need to develop. But again, for most women, this is not the issue. I want to talk about something we don't discuss enough: the relationship between masturbation and body image. Many women in their 60s and beyond struggle with how their bodies have changed. Weight gain, sagging skin, wrinkles, surgical scars, changes in breast shape and size, hair loss, or growth in unexpected places. Aging changes our appearance in ways that can feel alienating, particularly in a culture that equates beauty with youth. Masturbation can be an opportunity to develop a different relationship with your body, one based on function and pleasure rather than appearance. When you're engaging in self-pleasure, you're not looking at yourself from the outside, judging whether you're attractive enough. You're inhabiting your body from the inside, experiencing what it can feel and do. This shift in perspective can be profoundly healing. I've had patients tell me that learning to masturbate with awareness helped them make peace with their postmenopausal bodies in ways that years of positive affirmations never did. Because when your body gives you pleasure, when it responds to your touch with sensation and satisfaction, It's hard to maintain the belief that it's worthless or shameful just because it doesn't look like it did at 30. Function matters more than form. Sensation matters more than appearance. And masturbation is a direct experience of that truth. Let's talk about technology for a moment. The sex toy industry has exploded in recent years, and there are now countless products designed specifically with older women in mind. This is progress, but it can also be overwhelming if you're new to this world. Here's what you need to know. You don't need anything fancy. Your hands work perfectly well. But if you want additional stimulation, or if manual stimulation is difficult due to arthritis or reduced hand strength, a vibrator can be helpful. Look for one that's easy to hold, has multiple speed settings so you can start gentle, and is designed for external stimulation, clitoral, if that's your focus. Internal vibrators, for vaginal penetration, are also available. But many women find external stimulation more effective and comfortable, particularly after menopause. There are also products like wand-style massagers that are powerful and easy to position. Some women prefer smaller, more discreet bullet vibrators. The point is, there's no one-size-fits-all. If you're interested in trying a product, read reviews, start with something inexpensive and simple, and remember that it might take trial and error to find what works for you. Also, hygiene matters. Clean your toys before and after use with mild soap and water or a toy cleaner. Store them in a clean, dry place. Don't share them. Basic hygiene prevents infections and keeps your experience safe and pleasant. Something I hear from women occasionally: "I feel silly buying a sex toy at my age." Let me reframe that for you. Taking care of your sexual health and pleasure is no more silly than taking care of any other aspect of your health. You wouldn't feel silly buying a blood pressure monitor or vitamins or a good pair of walking shoes. A vibrator is a tool for well-being. That's it. The billion-dollar sex toy industry exists because people across all ages use and benefit from these products. You're not an anomaly. You're a consumer making an informed choice about your health. Now let's address medications, because many women over 60 are taking multiple prescriptions, and some of these can affect sexual function. SSRIs and SNRIs, commonly prescribed for depression and anxiety, are notorious for causing decreased libido and difficulty achieving orgasm. Beta blockers for blood pressure can have similar effects. Some antihistamines cause vaginal dryness. Certain pain medications reduce sensation. If you're experiencing sexual side effects from medication, talk to your prescriber. Sometimes switching to a different medication in the same class makes a difference. Sometimes adjusting the dose helps. Sometimes you and your doctor decide that the benefit of the medication outweighs the sexual side effects. But at least you've made an informed choice rather than just assuming this is normal aging. There are also some medications that can help. Low-dose topical testosterone, for example, can improve libido and genital sensitivity in some women, though it's used off-label for this purpose in the United States. Vaginal estrogen, as I mentioned earlier, improves tissue health and can enhance comfort and pleasure. Ospemifene is an oral medication approved for painful sex due to vulvovaginal atrophy. These are conversations worth having with a healthcare provider who's knowledgeable about sexual medicine. Let me address one more sensitive topic. What if you've experienced sexual trauma in your past? For many women, a history of sexual abuse or assault complicates their relationship with sexuality throughout their lives. Sometimes masturbation feels safe because you're in complete control. Other times, even self-touch can trigger distressing memories or feelings. There's no universal answer here. Some trauma survivors find that mindful, gentle self-exploration in therapy or on their own is part of healing and reclaiming their bodies. Others need to approach it very slowly or decide it's not something they want to pursue. Both responses are valid. If you have a trauma history and want to explore masturbation as part of your healing, I'd strongly recommend working with a therapist who specializes in trauma and sexual health. They can help you develop strategies for staying present, managing flashbacks or dissociation, and creating a sense of safety in your own body. Healing isn't linear, and it doesn't require sexual activity to be complete. But for some survivors, reclaiming pleasure on their own terms is a powerful step toward integration and wholeness. I think it's important to acknowledge that for some women, the question isn't, is masturbation safe? But rather, is it worth the effort? Maybe your libido is low and you genuinely don't feel motivated. Maybe you're dealing with chronic pain or fatigue that makes any additional physical activity feel burdensome. Maybe you're simply in a season of life where sexuality isn't a priority, and that's okay. What I encourage is curiosity and openness, rather than rigid rules about what you should or shouldn't be doing. If you're content without sexual activity, that's fine. But if there's a part of you that wonders, that feels like something's missing, or that remembers pleasure and wants to explore whether it's still accessible, then give yourself permission to investigate. Not because you have to, but because you deserve to have all the information and options available to make choices that align with your values and desires. One of the most common things I hear from women who've reconnected with their sexuality later in life is, "I wish I'd done this sooner." Not because they regret the past, but because they've discovered a source of vitality and well-being they didn't realize was available to them. They spent years believing the narrative that their sexual self was obsolete, only to discover that it was just dormant, waiting for permission and attention. Here's a small exercise I sometimes give patients who are curious but unsure where to start. I call it the pleasure inventory. Take a piece of paper and write down every source of physical pleasure in your current life. Not sexual pleasure necessarily, just any sensation that feels good. The warmth of sun on your face, the smell of coffee in the morning, the feeling of cool sheets against your skin, the taste of your favorite food, the satisfaction of stretching, the comfort of a hug. Make the list as long as you can. Now look at that list. This is evidence that your body is still capable of pleasure, that your nervous system still responds to positive stimuli, that pleasure is already part of your life. Sexual pleasure is just one category on that spectrum. If you're experiencing pleasure in other areas, your capacity for sexual pleasure hasn't disappeared. It may just be dormant or overlooked. Next step. Choose one non-sexual source of pleasure from your list and spend 5 minutes fully focused on it today. Just 5 minutes of being completely present with a sensation that feels good. Notice what happens in your body when you do this. Does your breathing slow? Do your muscles relax? Do you feel more grounded, more connected to yourself? This is embodiment. This is the foundation of being able to experience pleasure of any kind, including sexual pleasure. Masturbation, at its core, is an extension of this practice. It's about paying attention to sensation, being present in your body, and allowing yourself to receive pleasure. The more you practice embodiment in small, everyday ways, the more accessible sexual pleasure becomes. Let's talk about something practical: timing and circumstances. When is the best time to masturbate? The honest answer is, whenever works for you. But here are some considerations. Some women find that morning is easiest. They're rested, they have privacy, and they can start their day feeling relaxed and positive. Others prefer evening or right before sleep, using orgasm as a natural sleep aid. Some women take advantage of moments of solitude during the day whenever they arise. The key is removing pressure. You're not scheduling sex with a partner where coordination is required. This is entirely flexible. If you try and it doesn't work, you're distracted, you're not feeling it, you're interrupted, that's fine. Try again another time. There's no performance anxiety here. You can't fail at masturbation. You can only learn more about yourself. I want to address the role of fantasy one more time because it's such a charged topic for many women. Your fantasy life belongs to you. Nobody else gets a vote. What you imagine during masturbation can be anything. Memories of past experiences, scenarios that would never happen in real life, erotica you've read, something completely invented. Fantasy doesn't reflect your real-world values or desires in any straightforward way. It's play imagination, a space where you can explore without consequence. Some women feel guilty if their fantasies involve anything they wouldn't actually want to experience: dominance or submission scenarios, sex with strangers, revisiting past relationships. Let me be absolutely clear. Fantasy is not intent. What turns you on in your imagination doesn't obligate you to anything. It's not a reflection of your character. It's not evidence that you secretly want these things in reality. It's just your brain playing with arousal triggers, and that's perfectly normal. Other women find that they can't access fantasy at all, particularly if they've spent years suppressing sexual thoughts. That's okay too. You can focus purely on physical sensation without narrative, or you can explore whether reading erotica written by and for women helps jumpstart your imagination. There are excellent resources out there now, ethical, well-written erotica that centers female pleasure and autonomy. If that interests you, explore. Let me share one more story before we start wrapping up. Her name was Judith, and she was 73 when I met her. Judith had been celibate for 15 years, ever since her husband developed dementia and eventually passed away. She'd been his caretaker for the last 5 years of his life, and there'd been no space for anything remotely sexual during that time. After his death, she assumed that chapter was permanently closed. She was 70, alone, and convinced her body was done with all of that. But Judith started having a recurring dream. In the dream, she was young again, dancing, and someone was watching her with obvious desire. She'd wake from these dreams feeling flustered, confused, and oddly energized. She mentioned it offhandedly during one of our sessions, expecting me to dismiss it as meaningless. Instead, I asked her, "What do you think your unconscious is trying to tell you?" Judith looked at me for a long moment, and then she started to cry. "I think it's telling me I'm not dead yet," she said. "I think it's telling me I still want to feel alive." We talked about what feeling alive might mean for her. Judith wasn't interested in dating. She had no desire for a partner. What she wanted, she realized, was to reconnect with her own body, to experience sensation and pleasure that wasn't about caregiving or duty or loss. She wanted to remember what it felt like to inhabit herself fully. Judith bought a book about sexuality and aging. She started with the pleasure inventory exercise I described earlier. She took long baths and paid attention to the sensations. She bought a small, simple vibrator, and after several weeks of building up her courage, she tried using it. It took time. It was awkward. But eventually, at 73, Judith had her first intentional, self-directed orgasm in over a decade. She told me it felt like reclaiming a part of herself she'd thought was lost forever. Not just the physical sensation, though that mattered, but the sense of agency, of being able to give herself something pleasurable, of knowing that aliveness was still accessible. "I'm not done yet," she said to me, smiling. "I thought I was, but I'm not." That's the message I want to leave you with. You're not done. Your capacity for pleasure, sensation, connection with your own body, it's still there. It may be dormant. It may require some effort to reawaken. It may look different than it did 30 years ago, but it's there. And if you want to access it, you can. Safely, healthily, in ways that honor both your physical reality and your emotional needs. Masturbation after 60 isn't just safe. It's an act of self-care, autonomy, and vitality. It's a rejection of the narrative that says your sexuality expires when your fertility does. It's a way of saying, I'm still here, I still matter. My pleasure, my body, my experience, they count. Let me give you something concrete to take away from this conversation, because information without application is just entertainment. Here's your challenge for this week. I want you to spend 10 minutes, just 10 minutes, engaged in intentional embodiment. Not necessarily masturbation, though if you want to explore that, please do. But at minimum, I want you to spend 10 minutes fully present in your body, noticing sensation, paying attention to what feels good. Maybe it's a slow, mindful shower where you really feel the water. Maybe it's massaging lotion into your skin and noticing the texture, temperature, and pressure. Maybe it's stretching and feeling your muscles engage and release. Maybe it's sitting in the sun with your eyes closed, focusing on the warmth on your face. Whatever it is, I want you to practice being in your body rather than just operating it like a vehicle you're stuck driving. Why? Because embodiment is the foundation of pleasure. You can't experience sexual pleasure if you're disconnected from your physical self. If you're living entirely in your head, if you're treating your body as an inconvenience or a problem to manage. 10 minutes of intentional presence is a radical act in a culture that teaches women, especially older women, to ignore their bodies unless something goes wrong. And here's the second part of the challenge. I want you to question one belief you've held about sexuality and aging. Just one. It might be, I'm too old for this. It might be, nice women don't do this. It might be, my body is too broken or changed. Whatever it is, I want you to interrogate it. Where did it come from? Who benefits from you believing it? Is it actually true, or is it just a story you've accepted without examination? Write it down. Look at it. Question it. You don't have to change your belief or behavior immediately. But I want you to practice critical thinking about the narratives that shape your choices, because often the biggest barriers to our well-being aren't physical or even emotional, they're ideological. They're inherited beliefs that were never ours to begin with. So here's what I need from you right now. Hit that subscribe button if you haven't already. Share this video with a woman in your life who needs to hear that she's allowed to experience pleasure at any age. And drop a comment below telling me, tell me if anyone ever made you feel like your body had an expiration date. Let's start a conversation. Let's break the silence that keeps women disconnected from their own bodies and well-being. You deserve pleasure. You deserve autonomy. You deserve to inhabit your body fully, not just maintain it. And masturbation, when it's something you choose freely and without shame, is one small but powerful way of claiming that right. It's safe, it's healthy, and it's yours. Nobody can take it away from you unless you give them permission to through your own shame or silence. I'm Dr. Valeria Montes, and I've spent my career listening to women, believing women, and helping women reclaim parts of themselves that were taken or diminished by a culture that doesn't serve their well-being. Your sexuality, your pleasure, your sense of vitality, these things matter. Not because they make you more valuable to anyone else, but because they're part of being fully human, fully alive, fully yourself. Thank you for spending this time with me. Thank you for being open to conversations that make many people uncomfortable. And thank you for believing that you're worth the effort, the exploration, and the care, because you are, always have been, always will be. Now go practice being alive in your body. You deserve it.